On the COVID-19 response team, I did a lot of contact tracing.
Case investigation to calling the cases, doing the interviews.
Making sure our clinic is running because we are still doing other services in addition to running the COVID response.
And figuring out from a day-to-day perspective what kind of staffing levels we needed and what we needed to build upon to be able to respond appropriately.
My department also did a whole lot of scheduling for patients once the vaccine became available.
I've been involved heavily with the school reporting and keeping in contact with school administrators and the school nurses.
And I also make sure vaccine management and setting up all of the different vaccine clinics that we've been doing around the county and within the health department itself, working with scheduling, helping with COVID vaccine and COVID testing.
I have done the reporting each week to the state for how many cases are occurring in long-term care facilities.
I did general business questions. We did basically a little bit of everything. So whatever needed done on any given day is kind of where I filled in and helped the team out.
COVID-19 has had a very significant impact on my family. My mom has dementia. She's 83 years old, and sadly she reached the point in time in her life where my dad was no longer able to care for her at home. And so we had to place her into one of our local wonderful care facilities. But the experience that we've had most recently is that the facility has had to limit in-person visitation because of COVID amongst staff members and also amongst a few of the residents as well too. It's been really hard because my dad is 88, and to show up at a window and try to have a visit with your loved one, it's really hard. My mom says things like, "I just wish I could hold your hand again. You know, I wish that we could go for a walk." And I said to the staff at the care facility, I said, "Why is this happening? COVID is still spreading, and it's had a really real and significant impact to my family. You know, and I'm absolutely heartbroken from my parents who will soon be celebrating their 64th wedding anniversary, and they likely are not going to be able to spend that day together because of restrictions because of COVID-19.
I think that there isn't a day that anyone has where they don't hear something about COVID-19. And I think we're flooded so much with information and sometimes misinformation on social media that makes people not really sure what to believe, what they should be doing, what they shouldn't be doing. I think that just as the influenza pandemic of 1919 reshaped public health, I think we're really living in a time of history and that we're going to see public health change forever as a result of this pandemic. Whether that's the result of legislature, whether that's a result of just the community's expectations of how we respond in the future. And I think one of the things I learned most definitely is to be flexible, plan for the unexpected. There was never a day, I think, in the last 18 months that went how we thought it was going to go from the moment we set foot in the door that morning. The other thing that I have really tried to learn and do better is to recognize that there's always a positive aspect to things, even when it seems that there's nothing positive going on. And there were days that were really, really hard, and we kind of ask ourselves, why are we even doing this anymore? And it seemed that there would always be a timely thank you or a phone call from someone that really expressed their gratitude for what we were doing, whether it be a Facebook message, a note that came in the mail, a tray of cookies delivered. And so just reminding myself always that while it can be hard, there are people out there that still appreciate the things that we are doing and the time that we're spending to keep our community safe and healthy.
If there's anybody I'd like to thank is my family and my friends. They have come alongside me, have texted me, have emailed me, have brought me dinner.
All of my family and friends, even people who I hadn't talked to in some time who personally reached out to me when they knew things were bad, Just a text here and there, how are you doing? I hope things are okay.
We put our lives on hold. Time stopped for us. And we were willing to do anything that we had to do for our jobs. And our families never questioned that, any of our families. They understood when we left for work for that day that we didn't know when we would be back. And sometimes it was well after dark. And I also want to thank my coworkers, and they became my family over the last year, more so than I think they even realized, because we each saw each other at our most vulnerable times and supported each other without question.
People would bring us donuts that morning, or cookies in the afternoon, or bottles of water, or anything to get us through, and thanking us again.
We've had really good support from the community, and just hearing that day in and day out has been really encouraging to know that the work that we're doing here does matter, it is important, and we are helping people.
There's several people that know my extension, and they'll call me and say, I know who to call. I just tell them, wait a minute, I'll call my friend Amy. You know, they remember me, and knowing that they feel comfortable to call me back is rewarding as well. So I thank them for that, for their confidence in us.